Hi everyone, my name is Susan Giglio. I'm a physical therapist and yoga instructor, and I'm here to talk to you about yoga for pelvic health. We're going to start today with simple anatomy and talk about the pelvic floor muscles, and we're going to talk about how breathing relates specifically to the pelvic floor muscles. So let's get started. I want everyone to sit in a comfortable seated position. I'm sitting in what's called easy seat posture, and this is usually comfortable for most people. If it's not, you might want to get a blanket and place it underneath your sit bones. And what that will do is sort of get you up in a little bit higher position and allow your knees to roll out just a little bit more, allow that anterior pelvic tilt of the pelvis. So in this position, I want you to first notice the bones of the pelvis. And so in the front of the pelvis is the pubic bone. In the back of the pelvis is the tailbone. And then the sides of the pelvic base are the ischial tuberosities, or in yoga we like to call them the sit bones because we sit on them. And so the arrangement of those bones makes a diamond. And if you look at my hands here, you can see that where the pointer fingers are touching is going to be the pubic bone, and where the thumbs are touching is where the tailbone is, and where we've got the web space here of my thumb is going to be where one ischial tuberosity is, and where the web space is on the other hand is the other ischial tuberosity. And so if we start by realizing that this anatomy is, we can make the shape with our hand. We can also use things like washcloths to kind of show that there is this diamond shape. In the next session, we'll be using the washcloth in our perineum to kind of help with some proprioception of those muscles. But picture first just that diamond shape. And what I want everyone to do is first rock forward onto the pubic bone, and then rock backwards onto the tailbone. And then rock forward onto the pubic bone, and rock backwards onto the tailbone. And do this a few more times, and start to make those movements a little bit smaller, so that you're not tipping so far forward or so far back, and come to a place where you feel like you're right in the center. And then I want you to do the same thing in the other plane by rocking over onto the right sit bone and the left sit bone and the right sit bone and the left sit bone. And then starting to make those movements smaller until at some point you get to where you feel like you're sitting right in the center. So once you feel like you're resting right in the center of the pelvic floor is the area right between the vagina and the anus, and we call that the perineum or the perineal body. And it's a really strong area in the pelvic floor that helps to support the organs. So I'm going to take my hands now and fold them so that you can still see that I'm in basically a diamond shape, where the tips of my fingers are forming the pubic symphysis and the heels of my hands are forming the coccyx, and the knuckles of my thumbs are coming out to make sit bones. And so this represents the deepest layer of the pelvic floor muscles, which we call the levator ani muscles. The levator ani muscles are synonymous with mula bandha, or root lock in yoga. And the yogis knew many, many, many years ago that the contraction of those muscles helped to provide stability in the poses, and they used it to control energy and to keep the energy lifting up throughout their practice. Today we know that the pelvic floor muscles are involved in closing the sphincters to the bladder and to the rectum. They're used for support and stability, and they're also involved in respiration, which we will talk about in a moment. And so getting to know your pelvic floor muscles, they are inside the bony framework that we just outlined through our movements. And so when we go to contract those muscles, we want to feel that lift from the center. So as the muscles contract, they flatten out, and as they release, they come back to a little bit more of a dome shape. And then if we were to bear down, which we do when we defecate, we would feel them lengthen. And so we want the muscle to be able to move through the entire range of motion of contract, relax from contraction, and lengthen. And so take a moment now just to see if you can feel your muscle contract and lift. Come out of the contraction, and then a little bit of a lengthening, just like you're going to pass some gas. Okay. So when we think about the pelvic floors, I'm going to change my hand position now. I think the hands can do so many different shapes, so it's really cool to involve them in this teaching and learning of how your pelvic floor muscles work. So as I change my hand position here, my left hand is going to be representing the base, the surface on which I'm sitting. And so in this case, it's going to be the blanket. If you're sitting on a chair, if you're sitting on the floor, this is going to be the solid surface. And my right hand here is going to represent the muscles. So when I put my hands like this, the middle finger represents the pubic symphysis, and the hand and wrist where they meet is going to be the tailbone. My pinkies are going to be where my right sit bone, and my thumbs are going to be my left sit bone. So still making pretty much a diamond shape with my hands. And so as I take a breath in, I'm going to put my hands in a resting position, but you'll feel, if you don't contract the muscles now, but you're going to feel as you inhale a little bit of an expansion of those muscles, and exhale. And then inhale. And exhale. And then on the next exhale, I'm going to have you try to pull the corners of the diamond towards the center. So inhale, exhale, and pull tailbone to pubic bone and sit bone to sit bone, and as the center, that perineal body lifts. So there's an inhale and an exhale. And try it again. Inhale and exhale. Good. So relax your hands if you were doing that along with me. So what we want to talk about now, we've talked about the pelvis and the pelvic floor muscles. Now we really want to talk about what's happening up here with the respiratory diaphragm and the other bony framework that surrounds the heart and the lungs, called the rib cage, okay? So the diaphragm sits up inside the rib cage, and when we breathe in, it moves down, and when we breathe out, it moves up. This confuses a lot of people because it's hard to recognize that when we breathe in, the belly muscles, the abdominals, need to be able to relax, as does the pelvic floor. Because if they are tight, the diaphragm's not going to be able to move down, and that's going to inhibit how much or limit how much air is pulled into the lungs, into the bottom of the lungs especially, and there can be some more superficial, higher lung breathing going on that actually engages our muscles of, our accessory muscles of respiration more than necessary. And it does not allow the diaphragm to do as much work as it's supposed to be doing. So focus on your belly, maybe put your hands down here on your tummy, and just take a minute noticing where your breath is occurring in your body. So notice if your belly moves, notice if your rib cage moves, notice if your shoulders are kind of coming up and down. So don't try to change anything just yet. The next couple of breaths, just try to notice what's happening. I always find it helpful to close my eyes so that I can really feel what's going on in my body. So if you feel comfortable doing that, then go ahead and close your eyes and just put your hand in different places and notice what's moving. And then I'm going to invite you to bring one hand, let's have your right hand come to the space right where the ribs, the bottom of the rib cage, right above your belly button, and take the left hand and just put it on the outside of the rib cage here. And then what you're going to do is notice that when you breathe in, you can intentionally release the abdominal muscles and allow the upper belly to rise. And breathe out. And you can intentionally, after the upper belly rises, notice that there's movement of the ribs out to the side. So one hand above the belly button, breathe into that space, and breathe out. Hands to the rib cage, breathe in, and breathe out. Hand to the upper chest, one to the lower upper abdomen, breathe in, and breathe out. So oftentimes this is called three-part breathing because there's an initial movement of the upper belly, followed by a movement of the lateral rib cage, followed by a movement of the upper rib cage and sternum. And then the exhale can be done in reverse of that, but it requires that the abdominal muscles and the pelvic floor muscles stay relaxed. So what I want to invite you to do for just a moment is to tighten the pelvic floor like we just learned, squeeze and lift those muscles. Notice that the tummy muscles will get involved as well. And now try to take a deep breath in. And notice where the breath wants to go. So pelvic floor and abdominals are tight. Inhale. And exhale. And now intentionally release the pelvic floor and the abdominals. And breathe in. And breathe out. See if you can notice the difference between the breaths, and notice that you can get into those lower lung regions better, and you can slow down the breath better when you don't have your abdominals and your pelvic floor engaged. And so we call this bellows breathing. If you think about the way a bellows is made, it's made with two sides to it, and it's got a narrow area for the air to come in and out, just like we have a trachea, and it also has a diaphragm in the bottom. The bellows is used to stoke fires, and it's very symbolic for yoga because as we do our yoga practice, we are trying to stoke the fire inside of us and heat up the body through the breathing. And so if you picture your bellows and the sides of the bellows move out as it draws air in and the diaphragm moves down. And then as the sides of the bellows come back together, it forces the air out and the diaphragm moves up. So there's an inhale and an exhale. And an inhale and an exhale. Another reason why the abdominals and pelvic floor need to stay relaxed is because your internal organs need to move somewhere as the diaphragm moves down. Now during quiet breathing, it only moves down about a half an inch or an inch, but during intentional breathing, as we practice in our yoga practices, the diaphragm can move down as much as 2 inches. And with that 2-inch gain in movement, it's going to move the internal organs. And the organs are going to have to go somewhere. They are going to go caudally towards the pelvic floor, or they're going to come forward. And so if the abdominal wall and the pelvic floor are tight, that movement is not going to happen, and it's going to limit the amount that the diaphragm can move. With a relaxed abdominal wall and pelvic floor, they can absorb some of that movement. And in physical therapy, we like to refer to the movement of the diaphragm and the pelvic floor as sort of a pistoning movement, where the diaphragm moves down, the pelvic floor moves down, the diaphragm moves up, and the pelvic floor moves up. And so sometimes using your hands in this way as you're practicing the breathing will help you understand why and how the pelvic floor contracts on the exhale. So that concludes session 1. We'll see you back here for session 2. Thank you for your time. Namaste.